Well, for more on the reasons behind Pakistan's high rate of stunted growth in children, I spoke with journalist and public policy commentator Hasaan Khawar.
When you look at these percentages, they can hide the disparities. And it's not just 41%. You are talking about cities and provinces in Pakistan which have as high stunting as, let's say, 50%, which is remarkable because in a country where you have fast motorways, you have cutting-edge power plants, so this is ironical. And I think building infrastructure is easy, but having something like stunting and malnutrition goes deeply into your governance structure, the way your state operates, the way you provide services, and which is much more complex than building infrastructure. And I think in Pakistan, if you look at last many years, the rate of stunting has gone down by, let's just say, 0.5% a year, which shows that we have not really been up to the mark in terms of bringing it all together. And also when you look at a problem like stunting, it's a multi-sector issue. So in poor countries and in countries with low state capability, generally the governments are organized into silos. And when you look at a problem like nutrition, where multiple departments and agencies have to come together and act coherently, this weakness becomes all the more pronounced. So I would link it directly with poor governance in the country.
Now, obviously, this isn't an issue that developed overnight. So talk about some of the underlying issues and factors that got Pakistan to this point.
So I would say that poverty is the mother of this problem, because when you are poor, you are tend to be likely to be illiterate, you have low awareness, you might be living in an area which is not well equipped, you have poor sanitation facilities, you have low access to health facilities, you have low access to quality food. So I would put poverty as the #1 reason. And it's so closely related that research shows that if you, let's say, increase the income per capita by 10%, it can lead to about 3% reduction in stunting. And if you look at Pakistan, we have not worked on poverty reduction as effectively as we should have. So that is perhaps the root cause of this problem.
Give us an idea of why you think this isn't being worked on more and just what sort of economic fallout we could be looking at.
So when you look at stunted children of today, you are actually looking at a suboptimal, low-performing, underproductive labor force of tomorrow. So the problem that you are facing today, we are going to pay the cost for the next 30, 40, and 50 years. And this economic impact happens through impaired learning of children, through poor performance in schools, to when they grow up, lead to low adult labor productivity, and also to increased healthcare costs. And all of that add up, because when you're talking about a country like Pakistan, where there are 200 million people and more than 10 million stunted children, you are looking at a huge economic cost. And some estimates put that to about 3% of GDP, which would be something like $10 billion. But other estimates even believe it to be much higher. And that is the cost that we have to pay every year for inaction and for not doing enough.
Speaking of action, what about the government? What are they doing to address this issue? And what about the private sector and some of these non-government organizations?
The issue has been very high on the radar thanks to our development partners in our media. So the issue has been repeatedly highlighted. And there have been a number of interventions ranging from universal iodized salt program to nutrition alliances to minimum pasteurization laws. But when you look at private sector, it has limited footprint. And when you are looking at a problem which is as deep-rooted as stunting, you are looking at areas which are remote, which are poor, where private sector has limited footprint, and that is where you need an effective state intervention. So the private sector can complement the effort of the state, but it cannot act as a substitute to what state does. And when you look at the government, as I talked earlier about the silo approach, so it's even difficult to track expenditure on nutrition because it's a multi-sector expenditure, and it becomes very hard to bring everyone on the table. And if you look at the more recent history, Pakistan, you know, is facing an economic crisis, which means working on fiscal deficits, which means cutting down development expenditure. So this shows that Pakistan currently is actually having a very hard time in bringing together the resources to attack the problem. And my gut feel is that the next few years are going to be tough in this respect.
So as you look around the world at other countries that are also tackling malnutrition and stunting, are there any countries that come to mind that Pakistan could look to as a good example?
So I would say Peru is a great example, because if you look at Peru, Peru used to have very high rates of stunting, and in a very short span of time, they reduced that to about half. So I think that is one example, and some of the interventions that they have used and the other countries have used are the conditional cash transfers. And if you look at Pakistan, we have a huge cash transfer program, Benazir Income Support Program. So I believe if the government makes use of that program and bring in conditional cash transfers, that could be a good lever to give it some push.